All right, well, we'll go ahead and get started. It's right at 6 o'clock. So thank you. Thank you to everyone that's joining us today. With the Compassionate Cultivation team, myself and our content creator, Francesca, we have Dr. Kristen Taylor. Dr. Kristen Taylor is a physician at Cook Children's, treating children with movement disorders, as well as prescribing medical cannabis to some of her patients. And so we appreciate having you. Dr. Taylor is going to do a short presentation for us, and then we'll open it up. Feel free to ask questions in the Q&A, leave comments on our Facebook page, and she'll take your questions after she's done. So take it away, Dr. Taylor.
Awesome. Let me share my screen with you guys real quick. Can you guys see my PowerPoint?
Yes.
Awesome. Okay. So today I'm going to be talking mostly about cannabis and spasticity, which I'll kind of go into what the definition of spasticity is in just a little bit. We will start with a brief introduction of myself and then move into spasticity and conditions that are associated with spasticity, and then how to use cannabis product in treating spasticity. So I am a pediatric physical medicine and rehabilitation physician, pediatric PM&R or pediatric physiatry. It's all the same. There are about 300 pediatric PM&R physicians in the nation. I am the only one in Fort Worth. There are a cluster of us in Dallas. There's a cluster of us in Houston. There's one in Austin, and then there are 2 in San Antonio. And that is it for the state of Texas. But most of us with the recent pandemic have gotten the ability to do telemed visits. And so we are able to kind of stretch ourselves across the state to help patients who need any sort of support. Our biggest focus is always quality of life and improving independence and function for our kids that have chronic disabling conditions like cerebral palsy, spina bifida, stroke, spinal cord injury, brain injury, any and all of the kind of bad things that can and do happen to kids sometimes, less so than adults, but still there. But we always focus on quality of life, and not just the quality of life of the kiddo, but the quality of life of the parent. So sometimes my goal is helping the kid achieve a goal, but a lot of times my goal is helping the parent achieve a goal, whether that be getting dressed, whether that be going to the bathroom a little bit easier, learning how to walk, learning how to talk, those sorts of things. But all of the things that make a kid happier and healthier throughout their life while dealing with a medical condition that's affecting them every day. So what is spasticity? The doctor words are velocity dependent muscle contraction. So what does that really mean? That means when we move a kid's muscles, or if a mom or dad moves a kid's muscles in a quick fashion, they get tight. So a lot of times parents will notice, like if they're trying to get their kiddo dressed in a big hurry, or if they're trying to move them really quickly because it's raining and so they're trying to transfer their kiddo from the car seat into the stroller or anything like that, their arms will kind of like tense up or their legs tense up. Anytime you try to do things fast, the muscles will kick in. Same thing with the legs. And then if you do a nice slow stretch, like what PT does or what OT does with the kids, nice slow stretches, they're actually able to extend their arms and legs completely. But as soon as you try to go fast, those muscles kick in really tight and you cannot move them through it. So this is an abnormal signal that's caused by a loss of inhibition of excitatory cells. So if your nerves are overly excited, they're telling your muscle to work, which just looks like super tight muscles. And this is usually caused by damage to the brain or the spinal cord. So again, conditions like cerebral palsy or spina bifida are the most common cause that we see in kids. So sometimes you'll hear people say that, like a doctor or a therapist or somebody will say that your kid has hypertonia. So that's kind of an umbrella term that hosts spasticity, but it also includes things like dystonia, which is like when the kid is nice and loosey-goosey in a wet noodle, but the second that they think about using their right arm, the entire right arm kind of postures and they lose the ability to control just their hand or just their elbow. And then rigidity, which is like the kids are like stiff as a board no matter what. If they're sleeping, they're stiff as a board. If they're awake, they're stiff as a board. If you're trying to move them, they're stiff as a board. You're like almost worried that you're going to break their bones when you try to move them. That's rigidity. So all of these kind of terms that we use interchangeably, but they're all slightly different in what I look at a kiddo that has muscle tightness. So what conditions are associated with spasticity? I kind of gave myself away here. Cerebral palsy, brain injury. And brain injury can be anything. It can be a stroke, like a stroke where you bleed into your head if you have a bleeding condition. It can be a hypoxic event, so kiddos that have like a near drowning, or if they required CPR for a long period of time and that their brain went without oxygen for a long period of time. Traumatic brain injury, most commonly in kids, is either a car accident or a fall. Occasionally we'll see it, a traumatic brain injury in sports like football or something like that. And then post-infectious, which I figured I'd throw that out there for the world that we're living in today, because we are starting to see some people and some kids that have had COVID and have now developed a post-infectious encephalitis, like an autoimmune attack on their own brains, which leads to brain injury and eventually leads to spasticity and other problems. Spinal cord injury, the most common cause in kiddos is car accidents in sports. And then hereditary conditions, so sometimes kids will have like hereditary spastic paraplegia or some other conditions that lead to nerve damage, permanent nerve damage, and that can lead to spasticity as well. And then autoimmune conditions like multiple sclerosis or autoimmune encephalitis. Sometimes we'll see kids that have like variants of multiple sclerosis and that sort of thing, but they tend to have some spasticity as well. So why do we treat spasticity? For me, the biggest factor is pain. A lot of research has been done on kids that have had cerebral palsy in the past 80 years or so. And initially we thought that kids that have cerebral palsy, about 60% of them have pain, but more recent data has suggested that about 100% of them have pain. It's just whether or not they're coping with it and living with it without telling anyone. And sometimes they're not telling anyone because they physically cannot, or they are cognitively unable to tell you that they have pain. But when you pay attention to small things like their heart rate or their blood pressure or the way that they act or the way that they look when you're changing their diaper or giving them a shower, you'll see the characteristics of pain. Their blood pressure goes up, their heart rate goes up, just like yours and I's. If we were in pain, the exact same thing would happen to us. But in addition to treating pain, which I think is really important, when your muscles are always on, you're wasting a lot of energy. I mean, think about it's having us do a plank 24 hours a day, 7 days a week. So your muscles are constantly on, which in these kids will lead to a lot of like they struggle to get enough calories to supply their own bodies. So they're very often thin. They very often have weak bones because their muscles are eating up all their energy. So the brain isn't getting the energy, the bones aren't getting the energy. The muscles kind of consume everything that we would want the calories to go to. And then obviously if you're wasting that much energy, you're more tired. And so you're just not able to perform as well in therapy. You're not able to perform as well in school. And they just tend to be a little bit more sleepy than usual. Spasticity can lead to a reduced range of motion. So I'm sure that all of us have seen kiddos that when you go to get them out of their wheelchair and you put them in bed, they still look like they're sitting in a chair. So they have lost some range of motion in their hips, they've lost range of motion in their knees or in their wrists. And that makes it really hard when we want to get them up and stand them, because all of a sudden they just kind of start shrinking down because their joints are literally stuck in that position. And when your joints get stuck in that position, it no longer becomes something that I can treat, it becomes surgical. And I know that every parent would want to avoid surgery if at all possible. So as long as we can stay on top of their spasticity, we hope to avoid surgery throughout childhood, or at the very best, have one big surgery around puberty and then kind of treat the spasticity every other period. And I say puberty because we go through a big growth spurt around puberty, and so it's really hard to stay on top of tone when we're going through puberty. Contracture development, like I said, with the reduced range of motion, eventually if you keep losing range of motion, your joints get stuck. And so in like your hip muscles, all of a sudden parents will tell me they can't lay on their stomach anymore, or when I go to put them on their stomach, they cry a lot, like it hurts them. So they tend to get a little bit stuck in their joints, and that can be painful and lead to early fractures. Like if they're stuck with their hips or knees bent and you go to change their diaper, I've seen people where they were just going to change a diaper or just transferring their kid from their wheelchair to the bed, and they hear a big pop. And all it is they broke a leg bone, just like that. They did nothing serious and they didn't mean to, but it happens. And ultimately, at the end of the day, my goal for all of these kids is try to avoid surgery for as long as possible. If we can get through a childhood with only 1 or 2 surgeries, I consider that a win. Because, like I said, their bones just aren't as healthy or strong as other kids. And so when they go in for these surgeries that are cutting their bones, they have a higher risk of not recovering very well because they have like 80-year-old lady bones. They're not strong. So if we can do everything possible to keep them loose and keep them stretched out, then that's what we want, to avoid surgery. So how do we treat spasticity? The biggest mainstay is stretching therapy and exercise. This is really hard in the kids, especially the ones that have a lot of muscle tightness in all of their muscles, arms, legs, trunk, head. A lot of kids will have a rotation preference in their head. So I know parents are trying, and I know that they're doing everything that they can, but it's impossible to stretch these kids enough to prevent spasticity from winning, because spasticity is there 24/7. And so there's no way you can stretch these kids 24/7 to fight this battle. So very often we start the kiddos on oral medications. And for any of you guys that are parents of kids that have spasticity, I'm sure these medications look familiar to you: baclofen, gabapentin or Neurontin, Valium, clonazepam, tizanidine, Dantrium. And a lot of these medications are, I don't want to say addicting, but they're habit forming. So once you start the kiddos on these medicines, you find that their body gets used to it, and you have to up titrate that dose quite frequently to be able to stay on top of the spasticity and to achieve the same dose or the same effect in the muscles that you would otherwise. A lot of my patients, I end up doing Botox injections multiple times per day. Botox, Xeomin, Dysport, Myoblock, they're all different brand names of the same neurotoxin, which works to block the signal from the nerve to the muscle, telling it to activate. But this, as you guys are, I'm sure, very aware, requires multiple injections to multiple different areas of the body, and so is kind of painful and traumatic for the parents, painful and traumatic for the kids, and is time consuming. So, you know, if there's a medication that we can find that works for these kids, then obviously that would be the preference. And last but not least, why we're all here today, using cannabis to help treat spasticity. So in using cannabis for spasticity, I'm not going to go into too much scientific detail. I know that there have been other podcasts in the past that went into like receptors and, you know, different neurotransmitters that and how they work in our brain and how they work in our bodies. So I'm not going to go on a crazy deep dive into the science of CBD, but just very briefly, cannabinoids, which are the active ingredient that we're looking for in cannabis, work by calming down those excited nerves. So if we can get those excited nerves to just be a little bit quieter, we can see a reduction in the amount of tightness or tone that these kids are suffering with. And if we have less tightness, then we're able to stretch them better. We're able to get better range of motion. We're better to get less pain. We're better to have an improved quality of life. So what about everything else? This is kind of what I like to talk to my patients about when they're in a room with me, is I try to pick a medicine that has more than one effect. So if I have a kid that has muscle tightness and pain, if I have a kid that has a lot of muscle tightness and parents are telling me, we haven't slept in years through the night, we cannot get through the night without sleeping. My kiddos that have autism or autism type features, the ones that bite on their fingers, the ones that tend to hit themselves in the head, kiddos that have anxiety about going to therapy, anxiety about going to school, anxiety about just life in general, or anxiety about, you know, I don't want you to stretch me because when you stretch me, it hurts. And then like I said, these kids have a lot of trouble gaining weight. And so in my kids that have poor appetite, or kids that have weak, like failure to thrive, because they just cannot gain the weight necessary to keep up with the calories that their muscles are burning. And then particularly in my spinal cord patients, there are some research and data out there that suggests that cannabis can help reduce the bladder spasms in patients with spinal cord injury. So if we can get people off of the medicines that are helping to prevent bladder spasms, then why wouldn't we do that with one medicine that can treat two different things? So you can't talk about the pros without talking about the cons. That's the rules. As a physician, you always have to do educated consent. So what are the side effects that I hear most often? The biggest ones are dizziness and sleepiness, but this is usually pretty well tolerated in kids. And then it's more about, these side effects are more prevalent in people that are doing like whole plant extracts and that sort of thing. It's not specifically CBD. CBD tends to be a little bit cleaner, a little bit purer. So as long as we're focusing more on a CBD product versus a combined product, I don't tend to see a lot of these side effects. I do always counsel my patients and their parents to start at a teeny tiny baby dose and go very slow with their titration. Like once a week, we go up on the dose. And sometimes in my kids that have had sensitivities to other medications in the past, I'll tell them go up on one of the doses. So next week, you're gonna go up on the evening time dose, and the week after, go up on the morning time dose. And so there's just little things that you can do to kind of tweak the patient's experience so that we're not giving them this huge new medicine and all of a sudden they're zombies. I do monitor all of my kiddos' liver function tests at least 1 to 2 times a year, especially my kids that are also on seizure medications, because those are also metabolized by the liver. And so we just want to keep a close eye on our kids' livers to make sure we're not, giving any toxicities or anything like that. But most of these kids end up getting blood work 1 to 2 times a year anyway, so it's not really an extra poke, it's just adding on a lab. So is there evidence to support the use of CBD or cannabis in the literature? This is just a very quick snapshot of multiple journals with a particular focus on neurology, complementary therapy and medicine, frontiers in neurology, the SAGE journal, Journal of Pediatric Neurology Society, and then the Mayo Clinic, which I'm sure 1 or 2 of you may have heard of. So these are all kind of articles that are out there that support the use of cannabis or CBD containing products. A lot of the European products are actually comparing like CBD and THC to placebo. And so some of them directly translate to what we have access to in the state of Texas, others not so much a direct comparison, but just proof that something in cannabis is effective and it does help. And most of these articles are patient-reported outcomes. So it's things that moms or patients or dads tell us, I notice when I take this medicine that I feel this, which to me, as somebody who focuses mostly on quality of life, that's the most important. If you tell me that you think it's helping, then I believe you. You have to live with your pain every day. You have to live with your spasms every day. I do not. So if you think that this helps you, I'm supportive of it and I want to help you do it safely and effectively. So how do you become a cannabis patient? All of this information is on the Compassionate Cultivation website, so I'm not writing anything new or reinventing a wheel, but you can find any provider on their website by just typing in your zip code or emailing them directly and asking. And then when you have a meeting with a provider, you should discuss all current treatment, but all past treatment that has failed, or what side effects you experienced on these medicines, so that we can know to be mindful of these side effects in you and kind of know that you're a sensitive patient, or maybe this will work, maybe this won't work, or we really need to keep a close eye on their trunk control with this because they lost trunk control when they tried baclofen. Things like that are really important. Your provider will enroll you in the Teacup, which is the Texas Compassionate Use Program. It's no cost to any patient or their families. It takes maybe 7 minutes of my time, very quick and very easy. And then you call Compassionate Cultivation to get your prescription filled and either delivered or picked up. And slow, like I said before, you slowly increase. This is always my rule. Go low, go slow. So start, usually on my kids, all the medications are weight-based. And if the lowest weight-based recommendation is 1 milligram, I like to start them at 0.5. Just because I have no idea how they're going to tolerate it. I have no idea how that medication is going to interact with another one of their medicines, if it's going to build up in their system, I like to go nice and slow. And then just educating the parents or educating the kids, this is what we're looking for. I want you to tell me that you have less pain. I want you to tell me that you have less spasms. And I don't want you to be a zombie or feel like your head is in the clouds. So if you experience that, take a step back. Go back to your lowest dose and call me, and we'll discuss all of this with your mom or your dad or you to make sure that we're staying nice and safe and effective. And like I said, update me frequently. So I like to get emails, I like to get my chart messages, I like to get constant updates just to make sure that what we're doing is safe and effective, but also so I can educate your other providers. If you're seeing GI, if you're seeing hematology, I want to make sure that everyone on board is aware of what we're doing and what they need to be aware of, because if they're prescribing you a medication that's metabolized by your liver, they need to know to be cautious with that medicine as well, so that we can all be on the same team to not cause harm. So why should you register through Teacup when you can buy this stuff on Amazon, right? You can buy anything on Amazon. You can buy puppies on Amazon nowadays. Crazy. So usually when I'm talking to patients or their parents about enrolling in Teacup, my big things are the safety and efficacy of the medication. The National Institute of Health about 2 years ago did a study on over-the-counter CBD products, and they bought 100 different bottles from different vendors, from things like CVS, Walgreens, but also Amazon and online. And what they found is that about 50% of the bottles on the label were accurate. So 50% of the products out there are inaccurate, meaning it says that a milliliter has 30 milligrams of CBD, and of the ones that gave you an actual milligram per milliliter, about half of those were overdosed and half of them were underdosed. And what was interesting is it wasn't consistent across the brand. So if you bought a brand today, Joe's CBD, hypothetically, when you bought the bottle today, maybe it's correct, but next time when you buy it, it's a different batch. And so maybe it's underdosed, or maybe it's overdosed. From bottle to bottle, it's not consistent. And then to me, like, that's pretty scary when you're talking about giving your kid a medication. But to me, what's even more scary is in some of the bottles, they found impurities. And impurities, like, it's not just like, oh, there was a little bit of food dye, when it didn't say that it was food dye. It was like, this one has Coumadin, which is a blood thinner that we give people that have fake heart valves. So you're giving your kid a blood thinner, which is also, by the way, used as a rat poison. Some of them had mercury, some of them had lead. So these are things that in a kid that already has nerve damage, the last thing you want to do is give them something that could potentially cause further neurologic damage and long term. So that's kind of a soapbox I get on when people talk about buying things on Groupon or whatever, is just, you know, you're taking your risk with your kid. And I understand that we all take a risk with our kids every day when we put them in our car or take them to school with coronavirus going on. I get it, but I just want you to be aware that this is a risk that we could avoid by enrolling you in Teacup and getting you a product that's tested and verified. There's also, anytime you're dealing with the pediatric population, there's legalities to consider. So when you have a kiddo on a medication that needs to be given during school hours, you give that medication to the nurse, and the nurse administers that medication for you. But with CBD, the nurse is going to need a physician's note saying that this child needs this dose at this time of this medication. And if you're not enrolled in Teacup, I cannot write that letter. I cannot write the letter saying you need these gummies. I cannot write the letter saying that this kid has anxiety and needs this I cannot write a letter that I am not prescribing a medication for. There's also home health nurses. So everyone knows that cannabis can be a kind of polarizing topic, and you run the risk of having a home health nurse that wants to judge you or like cast negative comments or negative glares at you for giving your kid marijuana. And it's like, no, this is not this is not something that I bought on the street. This is legal. This is through the state of Texas. This is a registered product. It's tested. It's safe. My physician is well aware. And then what I worry most about is having a school nurse or having a home health nurse or having a PT or somebody like that find out that you're giving CBD products to your child and for them to call CPS. And now we have a big problem because if somebody calls CPS on you for giving your child an illegal substance and they drug test them and they find a CBD product when no physician has recommended this product to you, that can put the parents in a really big predicament. So just to keep everyone safe and to keep everyone legal, I like to make sure that parents are aware of these risks before we even talk about enrolling in Teacup versus going to a local dispensary or buying things on Amazon or wherever whatever group, church group that's selling it, who knows. So how can people find me specifically? So I'm at Cook Children's here in Fort Worth, Texas, but like I said, you can find any provider who supports medical cannabis use and spasticity on Compassionate Cultivation's website. They're happy to help you guys find people that are willing to have these conversations with you and support you as you go through this journey with your child, but also with your family, to see if this is something that's realistic for you. And if it is realistic for you, how we can make sure that you're doing it as safe and effectively as possible. So that's my last question. If you guys have any questions, I'm happy to take them from people or from you guys.
All right. Thank you, Dr. Taylor. We do have a couple questions for you. And we just want to give you a big, more of a public congratulations on upcoming birth of your baby girl. And we hope that everyone is super healthy. All right, so what are the age range of patients that you see that you prescribe medical cannabis?
So I have patients in the NICU, so premature babies all the way up to, they cut me off here at 21. I am technically board certified in adult rehabilitation as well, but because I work at an exclusively pediatric hospital, they make me graduate patients at 21. So the age range really is huge. So
yeah, that's awesome. And what's the age range or the youngest that you would feel comfortable prescribing cannabis?
Probably around 6 months. I mean, because I think about like what's the age range that I would put a kid on Valium. You know what I mean?
Right, right.
Valium has side effects. Valium has monitoring that needs to happen. Valium is a discussion to have with a parent. It's not benign, and the side effects of it can be serious. So, if you're going to have that conversation about Valium, then you should have that conversation about cannabis. So I don't think I really have, I doubt I would prescribe it in the NICU, just because I think that I would get a lot of pushback doing something like that on an inpatient setting. I think a lot of other providers would have opinions about it needs to be done as an outpatient. But I actually I've had one friend who was admitted in the PICU who I got consulted specifically because the PICU doctors weren't able to ask questions about cannabis. So I did have a kiddo that I started on cannabis in the PICU.
Okay, awesome. Another question we had says, has cost been a barrier to your patients, their families?
Yes. So I know that this medication is not covered by any insurance. It doesn't matter if you have Medicaid or Blue Cross Blue Shield or double coverage on multiple different insurances, like some by mom or some by dad. This medication is expensive, but like I said before, you have to weigh the risks associated with buying something that may be cheaper but not as safe. And so that's a discussion to have with the parents. And then what I find most frequently is parents are willing to find the money, or families will crowdsource the money, or support groups will crowdsource the money if they believe in the product. And so making sure that everyone is kind of on board with the product and knows that it's a safe choice to try. And then usually I do talk to my parents about Compassionate Cultivation's delivery service and pickup service, that if you decide you want to try this product, that you guys understand that it's not always possible to buy a month's worth of medication all at once. And so that you guys can very often do multiple deliveries within a month to ensure that parents are able to afford each delivery. Some parents get paid weekly, some parents get paid based on what shift they work. So working with parents on their budgets to try this product and see if it's something that's effective for their kid.
That's great. Thank you. All right, another question. So the legalization of unregulated hemp has drawn consumers away from the regulated market. Due to the low THC, the 0.5% by weight in the compassionate use program, is there reason enough to increase legal THC for the compassionate use program? Do you see a benefit to increasing?
I do for specific patients. So I try to avoid the higher ratio of THC to CBD in my kids with spasticity, just because the evidence shows that the higher CBD ratios are better for them. But in my kids that have an underlying condition of autism or self-harm behaviors, like hitting themselves in the head or biting their fingers, some of those kiddos, you know, it may be beneficial to try something that has a little bit more THC, or if they have a lot of anxiety or anything like that, you may want to avoid, like there are certain conditions where you want THC and certain conditions where you do not want THC. Spasticity, you know, you guys always recommend the 3-to-1 blend, and so I tend to stick with that for what I'm treating. But I think it would be really helpful in potentially other conditions to have broader access to other ratios. Like in Canada and Europe, they have a medication that's like their equivalent to the FDA approval called Sativex, which is 50% CBD, 50% THC. And that medication has been very well studied and very well researched in adults with spasticity related to spinal cord injury or multiple sclerosis, and actually has improved outcomes when compared to pure CBD. So I think, unfortunately, the US is kind of behind the times on CBD and THC and the ratios that we allow. And I am hopeful that one day there will be other ratios available. I'm also a big proponent for whole plant extract. And I think that I equate it, and parents have heard me say this in the clinic, I equate it to eating an apple versus taking a B vitamin supplement. You know, we all know that the apple is better for you, but we all eat Whataburger, and so we take the B vitamin supplement to get healthy. And so I equate cannabis the same way. Yes, I love CBD and I love what it does for my patients and their parents, but I wish that I was able to give a more comprehensive product, because I do think there's pieces of the plant that, you know, and I know that you guys are Compassionate Cultivation is working on it, the state of Texas is working on it, but I can't wait for the day when whole plant extracts are available, because I do think that that will be a big factor in treating all of these conditions and more.
Yeah. And I think if the THC cap would be raised, it would be more conducive, right, to do whole plant.
Yeah,
because you're not having to take anything out of it.
Yeah.
That was great. Thank you for answering that. That was really nicely put. How can patients approach their physician that they don't know if their physician's open to it, right? So their physician doesn't bring it to their appointment. They bring it to their appointment. What are maybe one or two good ways to open that conversation with physicians?
So I think that if you are very unsure about where somebody lies in the spectrum of cannabis approval or dissent, the easiest way that I would think to approach it is asking them how they feel about supplements. Because that's pretty vague and pretty generic, and it could mean anything from like essential oils to chiropractic care, and you know, there's a huge array that like, how do you feel about me taking like cinnamon extract to get my blood pressure down? How do you feel about ginkgo biloba to help my memory? There are a lot of supplements, and usually people kind of unfortunately cluster all supplements into one pool of thought in their brain. And so it's kind of like a gateway question that you can say, like, how do you feel about supplements? How do you feel, you know, if I wanted to try some things that were alternative? And I think it's funny, like when I don't bring it up in a visit and parents bring it up, you can tell they feel that nervous energy of like, what if they call CPS on me? Oh my gosh.
Yeah.
So I try to remind myself to bring it up as an option every single time. If I'm going to discuss baclofen or gabapentin, I should discuss cannabis as well. But for the opposite way, for the parents to bring it up with a physician, I think, asking, how do you feel about alternatives? How do you feel about supplements? How do you feel about me kind of doing some research on my own? Or I have, I'm on this cerebral palsy support group on Facebook. And some of the moms have mentioned that their kid does really well with CBD, or some moms have mentioned that I should try this. And just kind of, it's always easier to put it on someone else, right? A hypothetical mom on Facebook told me that.
Yeah.
Mom on Facebook could be me, we don't know.
They're real. They're definitely out there.
Absolutely.
And I think one of the last questions that we have, and we can wrap up this evening, is have you had feedback from, or what has been the feedback from your parents? So the parents of the patients, and how this may be improving not only as you said at the beginning, the kiddos' quality of life, but is improving the family's entire quality of life. Yeah. Can you speak a little more to that, I guess?
Yeah, so for the most part, I would say everyone has a pretty positive experience with it. I will knock on wood and say that I haven't had anyone call me and be like, this is terrible. So I think, to me, the risk is more, I didn't really see any benefit. And I caution parents before we even start the medication that I kind of anticipate no benefit at the beginning, because like I said, I start you on a 50 percentile dose. Like, I start you on what I call a cute little dose. And that's just because I want to make sure it's nice and safe and not going to interact with any other medications. So I very often, not very often, but sometimes I'll hear, I don't really think it's doing anything. And then the goal is always to up titrate. So slowly build up the dose over time to see if we get any effect at all, even at the bigger doses. But for the most part, I have nothing but positive experiences with my patients. I even have some kids that have like Tourette's syndrome and have tics, and it's like, I put them on it for spasticity, but holy bananas, we're not being bullied anymore. Like things that you just totally don't expect. This is like the first time we've slept through the night in 5 years. This is great. I can change a diaper without screaming pain for 20 minutes. I can, like, it's things that nobody expects, that kind of make me like happy about. Like, of course the PTs will tell you I'm getting better range of motion. I had a parent last week tell me, we put our kiddo on cannabis and I didn't tell anybody, and the teacher asked me what's different, that something had changed. So just hearing things like that, where parents tell you, I didn't tell anybody, but everybody's noticing, or how it's impacting the parent's life, that's always exciting to me, because like I said, it's not just the quality of life of my kid, it's the quality of life of everyone in the room. I know that taking care of these kids is a full-time job on top of the other kids that you have, on top of your marriage, on top of school, on top of work. So anything I can do to make your life a little bit easier, that's great news for me to hear.
Awesome. Well, thank you so much, Dr. Taylor, for your time tonight. I really enjoyed how you put it into perspective on the terms of the quality of life of the family, because we know a lot of families out there need it, especially right now. So we appreciate you being a friend of Compassionate Cultivation, and we look forward to continue working with you.